Hey guys, and welcome back to the channel. Today we're diving into a topic that's super important for everyone, whether you have diabetes or not. We're talking about the connection between your skin and diabetes. You see, our skin is often a window into our overall health, and for people with diabetes this is especially true. We'll be discussing 12 skin conditions that are more common in people with diabetes. We'll talk about what to look out for, why it happens, and most importantly, what you can do about it. First up, we're tackling diabetic dermopathy. Have you ever noticed small, round, brown spots on your shins? They might be slightly indented and have a scaly or shiny appearance. These spots could be diabetic dermopathy. It's harmless and doesn't usually cause symptoms, but is more common in people with diabetic neuropathy and long-term diabetes. It can be a sign of other diabetic complications like retinopathy and nephropathy. Researchers believe it might be related to changes in the small blood vessels of the skin caused by high blood sugar levels. Next up we have Necrobiosis lipoidica, a more serious condition than diabetic dermopathy. It starts as small reddish-brown spots, often on the shins, which can grow larger with a yellowish waxy center and a reddish-purple border. The skin in the affected area may become thin and easily injured. It can sometimes be painful and ulcerate, increasing the risk of infection. The exact cause is unknown but is thought to be related to changes in blood vessels and the immune system caused by diabetes. About 0.3% of people with diabetes develop Necrobiosis lipoidica. Let's talk about Acanthosis nigricans, a condition that causes darkening and thickening of the skin. You'll typically notice it in areas with folds or creases, like the neck, armpits, groin, and knuckles. It's often associated with insulin resistance, a key factor in type 2 diabetes. When your body becomes resistant to insulin, it can't regulate blood sugar effectively, leading to a buildup of insulin in the blood. This can stimulate the growth of skin cells, causing the characteristic darkening and thickening. Nearly 75% of obese individuals with type 2 diabetes have Acanthosis nigricans. Diabetic blisters or bullosis diabeticorum are a rare but potentially serious skin complication of diabetes. These blisters can appear suddenly on the hands, feet, legs, or forearms and range in size from tiny to several inches across. They're usually painless and don't tend to be red or inflamed like typical blisters, but can be a sign of poorly controlled blood sugar levels. Researchers believe they might be related to nerve damage or changes in blood vessels caused by high blood sugar. While they often heal on their own within a few weeks, it's essential to keep the affected area clean and dry to prevent infection. Ever heard of eruptive xanthomatosis? It's important to be aware of. This condition causes small yellowish bumps to appear on the skin, often in clusters on the buttocks, elbows, knees, hands, and feet. It's often associated with very high levels of triglycerides, a type of fat found in the blood, more common in people with poorly controlled diabetes. If you notice these yellowish bumps, get your blood sugar and lipid levels checked. Eruptive xanthomatosis usually clears up once blood sugar and triglyceride levels are controlled with medication, diet, and lifestyle changes. Let's talk about digital sclerosis, a condition that can affect the skin on your hands and sometimes your feet. It causes the skin on your fingers to become thick, tight, and waxy, making them feel stiff and harder to bend. The skin on the palms might also thicken, and lines or grooves may develop on your fingertips. Digital sclerosis is more common in people with diabetes, especially those with long-term diabetes or complications like neuropathy. High blood sugar levels might play a role in damaging collagen, a protein that provides structure to our skin. Disseminated Granuloma annulare, or DGA, causes raised, reddish or skin-colored bumps to form in a ring-like pattern. These rings can appear anywhere on the body, but are often found on the hands, feet, and trunk. DGA seems to be more common in people with diabetes, especially type 1 diabetes. It's thought to be an autoimmune condition, where the body's immune system mistakenly attacks healthy tissues. While DGA is usually harmless and often goes away on its own, see a doctor for diagnosis and to rule out other conditions. People with diabetes are more prone to developing bacterial skin infections due to high blood sugar levels weakening the immune system. Common infections include boils, folliculitis, and impetigo, appearing as red, swollen, painful areas of skin that may ooze pus. High blood sugar provides a perfect breeding ground for bacteria. Nerve damage from diabetic neuropathy can reduce sensation, making it easier to injure yourself without realizing it, opening the door for infection. Keep your blood sugar under control, practice good hygiene, and see your doctor promptly if you notice any signs of infection. Fungal infections are another common skin woe for people with diabetes. High blood sugar creates a sugary haven for fungi, leading to infections like athlete's foot, yeast infections, and ringworm. These infections cause itching, redness, scaling, and blisters. High blood sugar weakens the immune system, making it harder to fight off fungal invaders. Keep your blood sugar in check, practice good hygiene, and keep your skin clean and dry to defend against fungi. Itchy skin can be more than just a passing annoyance for people with diabetes. It could be a sign of high blood sugar. Elevated blood sugar can lead to dry skin, a major culprit behind itching, and can also damage nerves, causing diabetic neuropathy. While dry skin and nerve damage are common causes of itching, rule out other possible causes like allergies or eczema. If you're experiencing persistent itching, talk to your doctor to determine the underlying cause and get the right treatment. Vitiligo causes patches of skin to lose their color and isn't directly caused by diabetes, but there's a potential link. Vitiligo occurs when the cells that produce melanin are destroyed or stop functioning properly. It's considered an autoimmune disorder, where the body's immune system attacks healthy cells. Both vitiligo and type 1 diabetes are autoimmune diseases, increasing the risk of developing other autoimmune conditions. While there's no cure for vitiligo, treatments can help repigment the skin or even out skin tone. Skin tags are tiny, flesh-colored growths that often pop up on the neck, armpits, groin, and eyelids. They tend to be more common in people with diabetes. Researchers believe that insulin resistance might play a role, with high levels of insulin stimulating the growth of skin cells. While skin tags are usually harmless, they can become irritated or bleed if they rub against clothing. If you're concerned about skin tags, talk to your doctor or a dermatologist for removal. Pause 2S. While we've covered many skin issues related to diabetes, there's one more condition that deserves special attention: diabetic foot ulcers. These are open sores or wounds that commonly occur on the bottom of the feet. Poor blood circulation, nerve damage, and high blood sugar levels slow down healing. Regular foot inspections are crucial. Proper footwear, clean and moisturized feet, and controlled blood sugar reduce the risk. Early detection and treatment are key. This concludes our video on diabetic skin problems and the top signs of diabetes on the skin. Remember, early detection and proper management are key to maintaining healthy skin. If you notice any of these symptoms, consult with your healthcare provider. Thank you for watching, and don't forget to like, share, and subscribe for more informative content. Stay healthy.